Good afternoon, everyone. Thank you for joining us on the first Monday of March, as we are now nearly a year into the pandemic, as we meet today with Alameda County Public Health and David Farrell to talk about some updates in PINs and public health orders and hear what is going on as it relates to COVID testing and vaccine outreach. As a reminder, we do record these presentations and we will provide them to you tomorrow along with the slides. So with that, I'm going to turn it over to David. David.
Yes, great. Welcome, everybody. Thanks again for joining us. Always a pleasure to try to bring you some information related to the pandemic. And as Nicole said, yes, this is the 1-year anniversary of the Life Care Center of Kirkland, Washington outbreak. Occurred 1 year ago today. That hit the news. And if you were like me, that news was earth-shattering because it meant that it could happen here too, and it certainly did. But here we are a year later, and wow, have we all learned a lot during this year. And things are going much better. Here's an update on the CDC Federal Pharmacy Partnership vaccination update. And wow, at least 50,000 doses have been administered to the 650 long-term care facilities in our county. And CVS has basically gone to, or Walgreens has been to all of those facilities. And as you can see, the number of doses administered to the staff is almost as close to the number of doses administered to the residents, which means that we're not really experiencing the vaccine hesitancy here in the Bay Area. And if you have made an effort to increase your vaccination rates, well, that's fantastic. I think this data is reflective of the efforts that the leaders have made to have a high participation rate in terms of the number of residents and staff accepting the vaccine. Don't give up. If you haven't achieved 85% with your staff, don't give up. Keep talking to them, keep trying to drive them to the Alameda County vaccine pods. If your clinics are over, we have solutions for you to keep your vaccination doses coming for those who might have decided now that they will accept the vaccine. And as we've discussed, just bear in mind that no guidance has really changed yet in the context of vaccination rates or lower positivity rates or the potential of Alameda County moving into the red tier. Nothing's changed as of yet. Keep testing, keep screening, keep up with all the specific infection control procedures that you have in place. But keep in mind, any day now, the Centers for Medicare and Medicaid Services and CDPH and the county will all be issuing new guidance reflective of the impact of the vaccine on your communities and long-term care facility residents. So just hang in there. The only thing that you can do to set your community up is to have a high vaccination rate, because you have to figure that the vaccination rate will figure into how open your community can become. So the higher the rate, the better your facility will be situated to get back to life somewhat as normal. Here in the county, we didn't just leave it all up to CVS and Walgreens. We also helped vaccinate long-term care facility residents and staff. We had a bunch of facilities that for one reason or another just didn't make it up onto the CDC Federal Pharmacy Partnership list. So we sent vaccination clinics to them via Hallers, Clayworth, and Wellspring. We also directly allocated doses to nursing homes who could vaccinate their own. And at least 1,000 of your long-term care facility staff got their first dose, and another 500 have got their second dose at our pods away from CVS. So because of all of that, everything went faster. In addition, hopefully you got my email last week, and I included this memo that went to hospitals and skilled nursing facilities. And this is really intended to protect your community and your residents and staff. So all the hospitals have been informed that if they're discharging someone to an RCFE or an assisted living or a memory care facility, and they haven't been vaccinated, they need to vaccinate them. If a nursing home is discharging someone to you and they haven't been vaccinated, the nursing home should vaccinate them. So, what we're pushing for here is a process that hospitals have been used to for years, where they have a tendency to vaccinate folks for the flu prior to discharge. And they're going to be doing the same for the COVID vaccine. At the same time, you should always be asking for people to be vaccinated before they're discharged to you, but you should not hold it as a yes, no, whether you'll accept somebody. The fact is that the supply is still low. You might have a hospital that simply doesn't have the doses. So please don't deny an admission because they haven't been vaccinated, but request that they be vaccinated before they arrive. If you do accept someone who hasn't been vaccinated, very quickly, you should arrange to have them vaccinated at one of our pods. One of our many areas that you can place an assisted living resident in a car and drive over. I would encourage you to consider the Alameda County Fairgrounds or the Coliseum, which all have drive-through service. So there's many opportunities for you to help a resident or staff member get vaccinated. But always ask the hospitals to do their part, but don't deny an admission if it doesn't happen. Just accept the admission and work with us to get them vaccinated. In addition, your contracted pharmacies, if you use Pharmerica or Omnicare, local CVS corner stores and Walgreens, these are all areas where you can assist residents and staff to get their second doses. In addition to, if you have the organizational capacity and competence on staff, then you can also register in CalVax, which will expand access for you in terms of how you can receive and distribute and administer the vaccine to your residents and staff as needed. And of course, Nicole is so good about sending these slides out, so you can just click on these links in order to get appointments for your residents and staff. Now, this is all preliminary, right? We're just trying to fill in gaps with this, with what we're sharing with you and with the email that I sent to you last week, because CMS and CDPH, they haven't provided further guidance about what happens after the third clinic is held in your facility. So we're expecting that CMS and the Department of Health and Human Services and CDPH will all fill us in, we hope, this week or next. But this is what we know so far, and this is the best way that we can help you right now. When you have your third clinic with CVS or Walgreens, be sure to let people get the first dose. We will figure out how to get them their second dose, but for anybody who's willing, they should get their first dose at the third clinic, because that first dose provides a lot of protection and antibodies that people need to fight off the virus or prevent spread. So CVS should be accommodating, and you should trust that in 21 to 28 days after your third clinic, we together will find a way for your resident to get that second dose. And there's lots of resources, as I mentioned. And with the Johnson & Johnson vaccine being shipped to our county by tomorrow, now we'll have even more supply. But the Pfizer vaccine has been amazing in our long-term care facilities. As I've shared with you before, we've been monitoring 26 nursing homes who were the very first to finish their first, second, and third clinics. And these 26 nursing homes in 2020 had many outbreaks, lots of cases, hospitalizations, and deaths. Here in 2021, though, only about a little more than a third of the facilities, these nursing homes have had an outbreak, and the number of positive tests, the number of residents hospitalized, the number of positive staff has all just fallen off a cliff. Not one resident has passed in these 26 facilities. Last year, 172 of them passed due to COVID. And then for all of the long-term care facilities in Alameda County as of late last week, it's been just a miracle, really, what the vaccine has done. We've seen a 74% decline in the number of deaths. 2021 has just been unbelievable in terms of the change compared to the last 5 weeks of 2020. So the Pfizer vaccine really doesn't just prevent people from getting severe disease, it also prevents spread. And here you can see, the impact of what happened when nursing home residents across the country started to get vaccinated. We saw their decline by 66%. At the same time, in the communities surrounding nursing homes during that same period, when people were not being vaccinated in the general public, they saw a 61% increase in their number of deaths. So this really speaks to the divergent paths associated with what happened when we vaccinated our residents and staff in long-term care facilities across the country. In addition, we looked closer at our 71 long-term care facilities that are located in what we call Healthy Places Index Quartile 1. So these are the, it's 23 skilled nursing facilities are in that group of 71 long-term care facilities that are located in zip codes that have suffered disproportionately in this pandemic. So these facilities had 112 separate outbreaks in 2020 and 140 deaths. And so we prioritized with CVS to try to have their clinics be first. We also prioritized to make sure that the nursing homes in those areas finished all 3 clinics first. We directed our mobile vaccine teams to those long-term care facilities in the priority zip codes. And of course, we invited folks to our pods from those places and also put our pods within those zip codes. And as you can see, we've had some great outcomes within this group as well. In terms of the nursing homes with the highest percentage of Black and Latinx residents, it's been like night and day between 2020 and 2021. And I'm glad we were able to prioritize these facilities. Oh, I picked the wrong presentation here. Hold on. Let me just pause for a second. Any comments or thoughts as I pull up a different presentation?
David, we just have one question back to when you were talking about vaccinations. And so what if you have a resident who is under 65? They live at a long-term care facility. This facility seems to be having some problems getting the residents to be able to register with the respective pods. Is there just a general, make clear that there's a general blanket covering for folks who live in long-term care, even if they're below 65? Is that true?
Say that one more. Can you ask that a different way?
Yeah, so they have a resident who's under 65, but is living in a long-term care setting. They're having some challenges, I guess, setting up an appointment with one of the pods. that there's no category that says long-term care resident. And when they take them there, they're under 65. So it looks like they wouldn't be eligible.
Well, in that case, I think I would suggest that that you take the resident to one of our walk-up clinics. And Fremont High School, there's a few of them that have walk-up clinics, and you could walk in there with some proof that the individual's a long-term care facility resident, and they should accept the resident as a walk-in.
Okay, and what would be proof that they're a long-term care resident? Just a staff member saying, hey, this is one of our residents?
That could be okay, or yes, I think a staff member accompanying to vouch for the person would be fine. If they were to have any challenge, I would encourage them to call me in the moment, and perhaps I could help.
Okay. And I think we had another sort of obtaining a physician's order. That's a great idea. If you can have their physician say, hey, this person needs to receive the vaccine, they live in long-term care, that's a great idea. Want to encourage folks to add their questions to the chat, or also in the Q&A, whichever is best for you.
Yeah, great. And are you seeing this pin 2113 now?
We are.
Okay, great. So just as we often do, I like to alert you to these pins that come out each week. So this one is a required survey for you to complete. Please go ahead and click on that link and fill out the survey. Oftentimes surveys like this are important so that your government agencies know what types of facility, type of residents you're caring for. And that way, we're better in the know in terms of what your needs might be. So please take the time to fill out this required survey. And then this one just came out today, and it is really important for you to review this one and to review it with your clinicians and make sure that the physicians that you work with also get a copy of this PIN as it relates to TB testing associated with the COVID vaccine. So oftentimes, as you know, your new admissions, we need to make sure that they have their current TB test. So in the context of accepting new admissions, please review this PIN, if you would, please. And I just want to spend the remainder of this time kind of finishing up this bundle that we were talking about a couple of weeks ago. As you recall, we're beginning to come out of the pandemic, and we had a webinar with you that talked about recruitment and retention and selection and best practices around a warm welcome so that new hires stay with you after you recruit them. The last piece of this mutually reinforcing leadership bundle we call staff stability is around attendance, or addressing absenteeism, or triggering reliability, whatever you want to call it. But what I want to do now is share with you best practices about the way that managers improve attendance and increase the number of staff coming to work as scheduled. Certainly the pandemic has thrown this for a loop, but now would be the time for you and your leadership team to start to implement best practices associated with creating staff stability, because that's the best way that you can impact quality of care and quality of life. So why do staff call off from work so much? Why is it that CNAs and personal care assistants have some of the highest absenteeism rates of any worker in the country? Why is that? The average annual call out rate for nurses' aides in the United States every single day is 10%, which means that 1 out of 10 personal care aides calls out from work, and that's pretty high. And research shows that the higher the percentage of people calling off, the more residents are assigned to your staff to care for, and quality of care goes down. Falls go up, pressure sores go up, hospitalizations go up, the higher the turnover and absenteeism there is. So put in the chat, if you could, what are the reasons? What are the root causes? This is a really complex problem, right? Absenteeism in a really diverse workforce. But let's face it, when 5 people call off work, it throws the entire organization for a loop. So why is it? So to address complex problems like this, good leaders use quality improvement tools like a cause and effect diagram or a root cause analysis. So I encourage you to consider what are all the root causes of high absenteeism. And what you find are there's many things that are beyond our control. However, there are lots of things on this root causes that are within our control. So I've been studying how to improve attendance in long-term care facilities for years and years. And there's not a lot of research out there, but I'm going to share with you what I know and what has worked for me. So consider this. There are social determinants of absenteeism. Here are the sick days and demographics of US workers in the United States. On average, everybody calls off about 5 days sick per year, 6 days for women and 4 for men. College graduates call off a lot less than folks with a high school diploma or less. Those who are divorced or separated call off more than twice as much as those who are married or have never been married. And those who get their health insurance through Medicaid call off 13 days a year compared to those who have, like Kaiser or traditional insurance, they call off only 3 days a year. So when you consider kind of the profile of your personal care workers at your facility, most are women, most haven't completed college yet. Half are divorced or separated, and probably 35–40% have health coverage through Medi-Cal. So think about that in the context of what you see here, and you can see that this is a very complex problem that we're trying to address. Who are the nursing assistants in the US? Well, 90% are women, 20% are born outside the US. The average age is 37, but 10% of all personal care aides are over 60. Nursing home and personal care workers get injured very frequently. And in 2020, being a CNA in a skilled nursing facility was the most dangerous job in the US from a mortality perspective. 50% have no formal education beyond high school. Some are going to college. Some are not going to college. 15% are working poor adults, and almost 40% rely on some sort of other public benefit in order to make ends meet. And in 2020 was a record year for absenteeism across all sectors and all businesses. Never been so high, and you can imagine why. We were in a pandemic. However, things are getting better now, and it wouldn't be a bad idea for you and your leadership team to think about how you can implement best practices to increase the number of people showing up to work as scheduled. So in the past, when I was trying to address absenteeism as a manager of a nursing home, I made a lot of mistakes, and let me share with you my old, really ineffective method to try to get people to come to work as scheduled. Number one, I would just let the department managers track their own employees' attendance and hope that they tracked it and followed up. Once in a while, we'd get really mad and we'd decide to discipline the very worst offenders who called off the most. And then maybe we'd even fire someone so that we could demonstrate to all the other staff that we're super serious about this whole absenteeism issue. And then we usually forget all about it until some really bad offender stopped coming to work. That is an old and ineffective method. It never really improved anything. So let's look at what works. Number one, absenteeism is an organizational problem. It's not an individual personal care attendance problem. Organizations either create the conditions where people come to work more often, or organizations don't create any type of conditions where people feel they should come to work as scheduled. When you treat it as an organizational problem, you treat it like we can change the conditions to change the outcome. So to get that started, that mindset of this is an organizational issue, not a personal issue, number one, you got to have just one single person that tracks everybody's attendance. And each employee has an attendance card, a calendar month, and the person in charge, as call-ins come in, they mark the attendance sheets accurately with very specific information about why the person called off. And then that allows you to start to count the total number of unscheduled call-offs per month. And this is the number that you're trying to influence by changing the conditions. So you might do that first count and realize, wow, in January, 55 people or 55 unscheduled call-offs happened in the month of January. So then you have like this baseline number, okay, 55. Let's try to get that down to 25. How would we do that? And so the way to do that is, again, you treat it as an organizational problem. You start to track the data. You start to total the total number of unscheduled call-offs per month. You should share that number with the staff at a general staff meeting. Hey, everybody, 55 call-offs last month. Wow, that was way too much. We got to do better with reliability is what you would say. And then you would talk about what call-offs do to the residents and how having too many residents per employee and how that impacts falls, how it impacts the consumption of people's meals, how it impacted the spread of the virus. The fact of the matter is short staffing is pretty bad for the staff, but it's quite horrible for the residents who are left waiting and very anxious. So the goal is to reduce the total number of call-outs. Again, 55 call-outs in January. To reduce the total, you don't focus on the very worst offenders who called off 7 or 8 times in that month. And you don't necessarily focus on the individuals who never call off at all. You really want to focus on the people in the middle who called off 2 or 3 times. Those are the ones you're likely to influence. And you can influence them by having some critical conversations more frequently. For individuals who have horrible attendance and they never show up, these approaches don't work, because usually those individuals have never been reliable and perhaps they never will. In addition, we always have a number of people who just never call off no matter what. And they're not going to call off no matter what, no matter what I do. I want to reward those people, but I'm not expecting too much differently for them. They're going to perform that way. They've always gone to school. They've always gone to work. I'm trying to influence the ones in the middle. And to do that, we want to make sure that we don't have specific nurses or supervisors who are actually causing absenteeism. Oftentimes, when we look at patterns of absenteeism, we might find, oh, what's going on the second floor memory unit, where every other weekend, all the personal care aides seem to call off. Oh, what do you know? That happens to be the cadence of when our part-time supervisor works on those weekends. Could it be that, they're calling off because we have a nurse ratchet who's not very nice to them? And that absolutely could be the case, right? We know that our staff looks at schedules. We know that they pay attention to who their supervisor is. And throughout the course of my career, oftentimes we find out that there's an individual who's actually triggering absenteeism. What do you do with that? Well, you talk to Nurse Ratchet. You find out what's going on. You do some coaching with her so that she can be a more effective supervisor. You let her know that if she's a more effective supervisor, then she'll have an easier job because her staff will show up. So you work with her, but you have to have a conversation. You can't ignore it. In addition, you want to try to trigger some better attendance through having better scheduling practices. And one way to do that would be for the leader to really pay attention to your staffing coordinator. Meet with them once or twice a week, find out who's calling off, find out who the most reliable is, support the schedule, guide the scheduler, monitor the scheduler, and be more flexible with the staff. Move away from policies that say that people have to provide you with 30 days notice in order to request a single day off. When you have really strict policies around requesting days off and giving 30 days notice to request a day off, those types of policies don't work well for busy working poor adults who are working 2 jobs and have 3 small kids to take care of. You really need to be more flexible. Be more flexible in letting staff trade days. Be more flexible in honoring requests for time off. The thing about it is if you have very strict policies that require someone to give you 30 days notice for 1 day off, your absenteeism will go up. Because staff, if they can't get that day off, they will just call off that day. And let's say that a staff member happens to get lucky to be able to get their daughter to a dentist who accepts Medi-Cal, and that dentist called on Tuesday and said that they could accept the daughter on Friday. Well, clearly, if she's working, she can't request the day off because it's not 30 days, it's 3 days. So that employee is left to do only one thing, which is call off and say she's sick so she could take her daughter to the dentist. And that's what she will do. And by doing that, she's actually following the rules. She made you work short-staffed because the rule enabled her and told her that the best way to get the day off is to surprise you with the day off by saying, I'm sick. You see? And so what I've had to learn is that as a manager of a healthcare facility, I actually don't control my staff and can't control whether they come to work or not. But I can have policies and procedures such that they communicate better with me about when they're not coming to work so that it gives me a chance to replace them. And therefore, in the latter part of my career, I got rid of all the very strict rules around requesting days off or trading days, and my attendance got better, my absenteeism went down, and my short staffing went down as a result. You have to kind of understand that relinquishing control of this is the best approach. It doesn't mean that you're not strict. I don't think any of my staff would ever say that I'm not strict. All I'm doing is trying to give us a better prediction of whether or not we'll be fully staffed tomorrow. And in the case of this caregiver who has to get their daughter to a dentist, I'd much rather her tell me 3 days ahead that she wouldn't come on Friday than calling up Thursday night at midnight to tell us that she can't come to work Friday at 7 a.m. See, your policy either drives an employee to surprise you with a call off, or your policy enables an employee to safely tell you that they're not coming to work on Friday. And you know what? If they're not coming to work on Friday, they're not coming to work on Friday. It's just better for you to know before Thursday night at midnight. So the goal here is to have that more predictable schedule, because 99% of the time, a day shift employee knows well before 11 p.m. the night before that they're not coming to work the next day. But they don't tell us. Why? Because the policy drives them not to tell us. So consider a no-fault attendance policy. What that is that if someone doesn't show up for their scheduled shift, it counts as one. There's no more approved or unapproved absences. Either you're there as scheduled or you're not. And if you're not, it counts as one. There's no more qualifying of absences as either just or unjust. And it removes inequity, and it removes the need to even ask the employee to get you a doctor's note. I tell my staff, please don't go get me a doctor's note. Whatever you tell me, I believe. You're adults, you're healthcare workers. The last thing I want is for you to go to Kaiser, spend 2 hours of your day to get a doctor's note, to bring it to me, to prove to me that you were sick. I say, no more. Don't do that. That's a waste of resources. I tell my staff, just tell me the truth, because I care about you and I care about your family. If you tell me you're sick, you are sick. The goal here is a perfectly staffed day at your community over and over and over again. And the definition of a perfectly staffed day is that no one called off that day. Hallelujah, right? That you didn't use any registry staff, that you had staff who knew your residents, who could know their baseline and know whether or not they had a slight clinical change. A perfectly staffed day means that you didn't have any, workers' comp modified duty assignments, and nobody was even in orientation. It was all full-time workers, and that you were staffed to budget and your overtime was less than 2%. See, I show my staff, and I encourage you as well, as I show them this slide, I say to them, this is what I'm striving for every single day. That's my goal right there every day, because I know if I reach this goal, you'll be able to deliver person-centered, focused, compassionate care to the residents. So the goal is never to try to give people warnings or fire them for poor attendance. No, this is the goal, a perfectly staffed day. And then we start to give feedback. So if we're keeping accurate attendance records, then you have to share the attendance record with staff. You have to recognize and reward those with good attendance, recognize and reward those with improved attendance, and recognize and reward the whole community when they go from 55 call-offs in a month to 25 call-offs in a month. So if you're keeping an attendance record for an employee, remember, you're the only one keeping their attendance record. The employee isn't keeping their own attendance record. So just by showing them the attendance record, it triggers behavior change for them to know that you're tracking it. Every 6 months, you should be analyzing your whole organization's attendance, not trying to find which employee to punish, but trying to find out whether or not if you created the conditions where people want to come to work, whether or not you move from 55 call-offs in a month to 25. And then I would encourage you to meet with staff. If you have staff who have a lot of call-offs, treat them with kindness and respect. I encourage you, just call in employees with high call-outs, sit down next to them, show them their attendance record, and ask them questions like this. Jennifer, I couldn't help but notice that you've called off 7 times since we hired you 4 months ago. Look at your attendance record, Jennifer. Jennifer, when we interviewed you, you said that you were very reliable. Jennifer, what happened to you over the last 3 months? And then you're just quiet and you listen to what Jennifer says and you nod your head no matter what and show empathy. And then you would say something to the effect of, Jennifer, has that issue been resolved? Do we have the right shift for you? Would it be better if you moved to day shift instead of PM shift? You work with these people, right? Because you already invested so much in them and you just hear them out. But at the end of the conversation, you essentially say to Jennifer, I know you can do better. I know you can be more reliable. Can you be more reliable? And you're likely going to get Jennifer nodding her head, and she's going to be so happy that you didn't write her up or fire her. And there's a high likelihood Jennifer will get better just because you had that conversation. The same old's true for your folks who never call off. Pull them into your office, show them their clean attendance record, and thank them for their reliability. But provide feedback. As a manager, you just having a conversation in a respectful way about people's reliability triggers better attendance. In addition, when people call off and they come back and you notice them back, say something to them. Hey, John, we missed you yesterday. I heard your son was sick. I hope he's feeling better, John. John, our community, it just runs better when you're here. So I'm glad you're back, John. You say something like that to John, who called off yesterday, and John is gonna, number one, be shocked the boss noticed, feel good that you're complimenting them essentially by saying, John, we're better when you're here, but also you're showing compassion. You knew the reason why John called off, and his son really was sick, and he's going to tell you about his son now. So by just in your daily rounds, noticing who called off, who came back, saying a few nice things, letting them know you're noticed, that triggers better attendance as well. And then, of course, when people call off, people should call them at home in a very kind and gentle way. Hey, Jennifer, you just called off. You said that you were pretty sick with flu-like symptoms, and I see that you're scheduled for the next 4 days. Jennifer, do you think that you'll be able to come in for any of your shifts? Maybe we should replace all of your shifts now, right? So being proactive, trying to stay ahead of Jennifer calling off 4 nights in a row. Don't let Jennifer call off 4 nights in a row and leave you short-staffed 4 days in a row. Call her up. Are you okay? Are you going to be able to come to the shift after this one? That's the best approach, but it has to be done in a kind and gentle way. And then every night, you should be leaving a very short list for your night shift nurses of who's available to work if someone calls in tonight. And we would always leave a list of 2 to 3 names. We would have called the person during the day. Hey, if the nurse calls you tonight, can you come in tomorrow? Yes, okay, we'll write you down. And that way, if you do get a call off, at least the night shift nurse has a short list of people to call to fill that shift. So, that's kind of the best practices of what you could do to trigger reliability. Just seeing if anyone wants to come off mute, either share your best practices or mention an idea that maybe you'll consider adopting. Nicole?
Yes, that was really interesting, David. I was especially, moved by the section which talked about, the types of demographics of people and how likely they are to call in sick. And, I think someone wrote in the chat that many work more than one job. And I think the point you've been making out for the entire last year is, yes, you're right. And why is that? And if we could really build loyalty by having someone work at one building, by compensating them fairly for their work, and the points you're making are really understanding who they are, who their family is, how we can support them in their efforts. I'm wondering if you can, speak to this idea of how we can set expectations when we hire someone. Because I'm from Nevada, a fun fact. And so I used to work in casinos, and that idea is that you should be able to work, any shift. And can you work around loud music and cigarette smoke? And I wonder what you think you can do from the outset as a facility to set the expectation about how crucial it is that staff show up for their shifts, as long as they're not sick, of course,
Sure.
and how important that is.
Yeah. So a couple of things, and we touched on this a few weeks ago. Number one, you got to give them some tests in the interview process. So yes, you should drop what you're doing and interview anyone who walks in your facility and fills out an application, but you shouldn't hire them on the spot. You should, if you like them a lot during your tour and your screening of them when they fill out their application, you should say, hey, can you come back at 4:30 today to meet with the director of nurses, and just see what they say. And if they can come back and meet with the director of nurses, then they pass that test. And then the director of nurses should say, hey, can you come back at 7 o'clock tomorrow? I want to, have you meet the infection preventionists. You just give them a few little tests to determine in the interview process whether they'll show up on time as you ask them to. So that's a really good way to see if they have, reliable transportation, if they'll come 10 minutes early. So those are good tests to do. The other good thing to do when you're hiring someone, as I mentioned before, I'll mention it again, is ask if they can go to their other facility where they just came from, or their other job, get a copy of their last performance review and show it to you. Because every performance review has a section on reliability, every single one. So if they're willing to go and do that for you and show you that, and you can see that section, that would really be your best predictors, if you will, of whether or not someone will be reliable for you. And to the point of the second job, I think the most important thing is, yes, people will have second jobs at other facilities, but for you at your community, you need a list of, all the employees who have benefits with you, essentially where you're their first job. And then you'll need to know, of course, via a list, who is really employees who are treating you as their second job because they have first job and benefits over there. And what I would do is every year, my list of my employees who are treating us as their second job, during open enrollment, I would try to convert them to us for their first job. So that you should be constantly trying to increase the number of staff that you're their first job, right? And if you're their first job, then their loyalty and benefits are with you. And the likelihood is that they're more likely to call off the second job than the first job, right? So The only way to do that, again, is by conscientiously kind of making the lists, approaching the individuals to try to convert them during open enrollment. And you'd be surprised how many you can convert during open enrollment to you being their first job. You just have to go about it in a systematic way.
David, I think that is really true. And I also think it's, when you have like a CNA class in your building, be looking for that student that's going above and beyond. Be like, hey, are you looking to join extra board? You know what I mean? When you have,
Yep.
and also going back to those CNA schools that you haven't had in your building for the last year. Hey, when's your next clinical come around? We want you here in this building, because then you get to train them in the way you want them doing things, and you get to set that high standard. And so I think that's really important to be looking around to always add people to your extra board, and be looking to convert people from your extra board to your main schedule, and be treating them well. And it has nothing to do with pizza parties. It has to do with, as you said, when the administrator walks around, do they know their name? Do they know their kid's name? Are they excited about where they're at? Have over the last year you been in the trenches with them, helping them do their work? And I think that's critical. We have some questions unrelated to staffing, and I love this conversation, but I also want to make sure we get these done. Do you think we can transition to that?
Of course, of course. We're offering some of these other topics because you're in, in the sense of this public emergency, all of us now hopefully are moving out of the disillusionment phase to reconstruction. And so that's why we're trying to offer some different topics related more to reconstruction that we're hopefully all in the process of. But sure, yeah, what are some of the questions?
Okay, so now that we're sort of post-vaccine clinics, we have some residents obviously who didn't choose to take advantage of, and some that did. But now, what happens if, say, like a resident wants to go to have lunch at their child's house? So it's a little bit longer than a doctor's appointment, and they're going to interact with family. Are there any restrictions on that? So for example, when they come back, would that resident need to quarantine for a period of time? Or could they go if they agree to sit outside with their family members and not be inside the dining room at the house? How does this work now with people leaving the building?
Yeah, well, nothing's changed in the context of the vaccine yet. We hope it does very soon. So just kind of keep pushing the vaccine out of your head in terms of, well, how do we react to this? Because how we react to someone going out is the same way we react before the vaccine, which would be, yes, lots of questions, encouragement of having their visit be outside, socially distanced, masked up, really inquisitive about who they were with and how many people and where it was. And then, likely being super cautious and considering having the person come back into the yellow zone or have a yellow status might be the way to go. Certainly for all new admissions, they should be treated as transmission-based precautions and yellow zone. I mean, nothing's changed there as well. So the same would hold true for a resident going out on an outing, just like we did over the holidays. Now, again, we're certainly hopeful that guidance will come out, which will change what I'm saying. But for the most part, we only have what the current guidance is, and that's what it is.
So we've got kind of a dense one. So I'm just going to read it to you as they've written. The health order on 11/23/20 mandates all home health or essential workers, not employees, to have a negative COVID test within 7 days. Is this mandate still in effect? But before you answer, let me just read the rest of it. If so, the question has come up as to why we only require 50% of employee surveillance tested. Why are we requiring sort of external employees to be tested more frequently than employees who are in the building every day?
Testing sites for testing everything. Yeah, I'm not involved with the health orders related to home health, so I can't really speak to it. But I'll certainly raise your concern, Nancy, with Dr. Moss and um, and see what he has to say. And perhaps I could get back to you next week, okay?
That's the last of our questions, but someone did note that some of the providers didn't receive the PINs and AFLs. And so just a reminder, everyone, you can sign up for those on the Department of Social Services website and also the California Department of Public Health website. If you have a problem with that, you can reach out to your analyst and they will be sure to get you signed up for that. So just to make sure that's a great tool to be reading those PINs and AFLs. We had a couple that came out today that I think you're going to want to stay up in.
Yes. And we'll give you the links as well.
Excellent. Well, David, I just want to thank you for a great presentation today. I'm looking forward to the follow-up conversation and to sending these out to everyone. We will send out the recording and the PowerPoint tomorrow. We appreciate all of your work and we look forward to seeing you back here next week.
Yes, and we'll probably keep these going for a couple more weeks, and we hope we're still meeting a need of yours. We anticipate, like I said, new guidance coming out associated with vaccine rates. So we'll be sure to be filling you in as the guidance changes. So thanks so much, everybody. Really appreciate all you're doing.
Have a great day.
Yep, take care. Bye-bye.